welcome back. You're watching Newslink on ENCA. I'm Annika Larson. Well, it's all hands on deck in Gauteng as the province's healthcare system remains at the mercy of skyrocketing COVID-19 cases. Premier David Makhura yesterday welcomed a delegation of medical personnel from the South African National Defence Force to the Chris Hani Baragwanath Academic Hospital. They'll be reinforcing the COVID-19 response in the province, and to tell us how the troops' deployment in Gauteng is going, we're joined by the SANDF spokesperson, Brigadier General Mafi Mgobozi. Brigadier General Mgobozi, thank you so much for joining us. I mean, it's a difficult task at hand. It's not been 24 hours. How are things going on the ground?
Yes, good morning, and then good morning to the viewers of the ENCN. First, I want to clarify something. The SANDF have not yet been on the ground. We are going to be deploying late this afternoon or tomorrow morning. Yesterday, we were there to iron up something which was a concern for SANDF, which solved with the Department of Health. So far, for us, in the afternoon or tomorrow morning, is all systems goes. Our troops, medical teams will be deployed at Baragwanath Hospital.
Brigadier Mgobozi, what was that concern that you had with the Health Department?
One of the concerns was that, as you know, that the Defence Force, members of the Defence Force have not yet been vaccinated, that if we cannot be able to deploy our troops in the hospital while they are not being vaccinated, that issue was solved. And then I must also state that amongst the members who are going to deploy, half of them, they are vaccinated. They came there, they were mobilized, and then they are already vaccinated. Those members are the members who are in the reserve force environment, who are working in certain hospital, who were called up to come and assist in Gauteng. So far, the half of the members of who are going to deploy in the Gauteng are vaccinated, and the half of them will be vaccinated today in the morning.
Is that enough time, Brigadier? Because I was actually going to ask you that as one of my next questions, is how do they feel if they're not medics and, as you say, they're reserve forces who haven't been vaccinated going right into the coalface? Is it okay to be vaccinated tomorrow and be protected in that time? And I presume some of them will feel might feel a bit poorly too, so shortly after a vaccination.
Yeah, the situation is going to be like this. The Defence Force, we are going to deploy those, as I have said, that half of them, as we are going to deploy the medical task group, which consists of 60 numbers. Half of those people have been vaccinated already, but not by they have been vaccinated not today, but they were vaccinated during when the Department of Health was doing vaccination for the health workers, because they are reserve force members who are working in some of the hospitals in other provinces, but they are the members of the Defence Force. So those one will be able to deploy them tomorrow, and then others which are going to be vaccinated today, we will deploy them as we look at the situation.
Okay. Are there plans to deploy SANDF medics to other provinces, and what are they actually going to do on the ground?
The plans on other provinces at the present moment, as the Defence Force, they only receive a request from the Gauteng province, and then to clarify this, we are going to be deployed at Baragwanath Hospital. It's not the Defence Force who identified Baragwanath Hospital. It was the Department of Health in Gauteng that if our members can be deployed there. The teams of which is going to Baragwanath include the nurses, the doctors, and the OPCs, or we call them the ops medics, and which in the layman term they always call it the paramedics. Those are the teams which are going to be deployed in the Chris Hani Baragwanath Hospital.